Is your diabetes secretly damaging your liver? Discover the shocking truth and how to protect yourself now. Connection between fatty liver and diabetes. The connection between fatty liver and diabetes is rooted in insulin resistance and metabolic dysfunction. In individuals with type 2 diabetes and insulin resistance, cells in various tissues become less responsive to insulin, leading to elevated blood sugar levels. Insulin resistance, especially noticeable in abdominal fat, causes the release of free fatty acids into the body, which are then stored in liver cells, leading to fatty liver disease. This excessive fat accumulation in the liver can cause inflammation and damage to liver tissue. Conversely, the accumulation of fat in liver cells intensifies insulin resistance, creating a cycle where each condition exacerbates the other. This interplay between insulin resistance, fat accumulation, and liver damage forms the basis of the connection between fatty liver and diabetes. Symptoms of fatty liver disease in diabetics. The symptoms of fatty liver disease in individuals with diabetes mellitus can include continuous fatigue and listlessness, difficulty concentrating, a feeling of pressure in the upper abdomen, a frequent feeling of fullness, complaints when lying on the right side, dark urine, light stool, and in some cases, yellowing of the skin and whites of the eyes, swollen abdomen and legs, mental confusion, extreme fatigue, and muscle weakness. It's important to note that fatty liver disease may not present noticeable symptoms in its early stages, making regular screening and early diagnosis crucial for individuals with diabetes to prevent complications and manage their liver health effectively. Diagnosis of fatty liver disease. Fatty liver disease is usually diagnosed through a combination of medical history, physical exam, blood tests, and imaging tests. Here are the key steps in diagnosing fatty liver disease. Number 5. Medical history. The doctor will ask about alcohol use, medications, and other health conditions to determine if it is alcoholic fatty liver disease or non-alcoholic fatty liver disease. Number 4. Physical exam. The doctor will examine the body for signs of fatty liver disease, such as an enlarged liver or jaundice. They will also check height and weight to calculate BMI. Number 3. Blood tests. Liver function tests are used to detect and monitor liver damage. Fibrosis assessment tests can estimate liver scarring. Other blood tests may check for hepatitis C, Wilson's disease, and measure blood fats like cholesterol and triglycerides. Number 2. Imaging tests. Ultrasound, CT, or MRI scans can detect fat in the liver, but cannot distinguish between simple fatty liver and non-alcoholic steatohepatitis, NASH. Transient elastography and MR elastography can measure liver stiffness to assess fibrosis. Number 1. Liver biopsy. In some cases, a liver biopsy may be needed to confirm the diagnosis and determine the severity of liver damage. A small sample of liver tissue is removed with a needle and examined under a microscope. How lifestyle changes can help prevent fatty liver disease in diabetes mellitus. Lifestyle changes play a crucial role in preventing fatty liver disease in individuals with diabetes mellitus. Here are some key lifestyle modifications that can help prevent fatty liver disease in diabetes. Number 4. Weight loss. Losing 5% to 10% of your current body weight can reduce extra fat in your liver, improve blood sugar levels, and alleviate stress on internal organs. Number 3. Healthy eating. Balancing carbohydrate intake, limiting sweets, and reducing saturated fats in the diet can protect the liver from fat buildup and support overall liver health. Number 2. Physical activity. Engaging in at least 150 minutes of physical activity per week can improve blood sugar utilization and reduce fat storage in the liver. Even short bouts of activity can be beneficial. Number 1. Limiting alcohol. Reducing alcohol consumption can decrease stress on the liver and slow the progression of liver damage. especially in individuals with liver disease or at risk for it. Fatty liver disease is a common risk for type 2 diabetics. This video explains the connection and how lifestyle changes like diet, exercise, and weight loss can help prevent it. Don't forget to subscribe for more health info.